The following educational video was created in cooperation with the Faculty of Biomedical Engineering and the General University Hospital in Prague. Blood collection for hemoculture and hemocultivation is prescribed to identify the etiological agent in the bloodstream. The recommended approach for this examination is the single sample strategy SSS, meaning a single blood draw. Collecting the entire required volume of blood at once from a single puncture site increases the sensitivity of the test by reducing the risk of sample contamination from repeated draws. For optimal results, it is recommended to collect 40 to 60 milliliters of blood at once, which corresponds to 4 to 6 bottles. This strategy is based on the finding that bacteria in the blood are continuously present during sepsis, even though their quantity may fluctuate, and there is no significant correlation with body temperature over a 24-hour period. When only one pair of bottles, 20 ml of blood is collected, the test sensitivity is 73%. Using 2 pairs, 40 ml increases sensitivity to 90%, and 3 pairs, 60 ml, raise it to 98%. In cases of suspected infectious endocarditis, blood samples should be repeated, typically in the arrangement of 3 pairs of blood cultures taken always at intervals of 12 to 24 hours from themselves. The ratio of aerobic to anaerobic bottles should be 1:1. If a fungal infection is suspected, an additional fungal culture bottle should be included. Patient identification labels must never be affixed over the bottle's barcode, as it is required by the automated culture device. The required blood level is marked on the side of the tubes. Before collection, a visual inspection of the medium's clarity and tube expiration date should be performed. After performing hand hygiene and confirming the patient's identity, we proceed with the prescribed blood collection for bacteriological examination. We thoroughly disinfect both the bottlenecks, either by wiping or spraying, as well as the selected puncture site. A post-disinfection swab of the puncture site as a control measure is no longer performed. The manufacturer recommends using a connector tube or a safety butterfly needle with a blood culture holder for collection. At the beginning of the collection process, air is present in the collection set, which is why the procedure starts with filling the aerobic bottles first. Blood is drawn from a peripheral vein or a newly inserted invasive line. Whenever possible, we avoid drawing blood from long-established intravenous lines, except in cases of suspected catheter-related infection. In such cases, a simultaneous peripheral blood draw should also be performed. During collection, the bottles are kept in an upright position, and the procedure is stopped once the blood level reaches the marked fill line. The needle is then removed and the puncture site is compressed. Afterward, all materials are properly disposed of, and the sample is sent for microbiological examination. If immediate processing is not possible, the sample is stored at room temperature until the following day.